Personal protective equipment for healthcare workers caring for patients with coronavirus disease, also known as COVID-19. The following guidelines for donning and doffing of personal protective equipment for COVID-19 is based on CDC recommendation for patients confirmed with or under investigation for COVID-19. The CDC guidelines call for strict adherence to standard precaution, contact precaution, airborne precaution, and eye protection. When preparing to care for patients with infectious disease, it is helpful to understand a series of events that occur to cause infection. This series of events is known as the chain of infection, and each link in the chain of infection provides us with the opportunity to break the chain and prevent the spread of disease. The chain of infection begins with the presence of an infectious agent or pathogenic organism. Here we will describe the chain of infection for COVID-19 to break the chain of infection and prevent the spread of a pathogen like COVID-19. The pathogen needs to be removed or destroyed. A healthcare worker performing hand hygiene with alcohol-based hand rub to disinfect their hand is an example of breaking the chain of infection by destroying the pathogen. In order to survive an infectious pathogen, it requires a reservoir host in which it can live, reproduce, and multiply. In the case of COVID-19, there is much to learn as the virus is new to infecting humans. Individuals infected with COVID-19 are a new host for this virus. The portal of exit in the chain of infection is the path by which a pathogen leaves its host to infect others. For COVID-19, the portal of exit includes the respiratory tract via respiratory secretion. This happens when a patient coughs, sneezes, or talks. In the chain of infection, the mode of transmission is the mean in which the pathogen travels to a new host. For COVID-19, the CDC recommends standard precaution, contact precaution, airborne precaution, and eye protection. In the chain of infection, the portal of entry is the path in which an organism enters a new host. The portal of entry can be through inhalation. This is done when a person inhales the pathogen into their body. It can also enter through mucous membranes by hand-to-face contact. Healthcare workers wearing personal protective equipment that offers respiratory protection prevents inhalation of an infectious pathogen. This is one way the chain of infection can be broken at the portal of entry. In the chain of infection, a susceptible host refers to a person who does not have the ability to fight off invading pathogens. To break the chain of infection at this point would require the potential host to have immunity to the pathogen in question. In certain situations, immunity to a pathogen can be acquired naturally as a response to past infection, or it can be artificially acquired by vaccination. The chain of infection is a useful tool, and consideration should be given to methods for breaking links in the chain early in the process. For example, healthcare workers caring for patients with COVID-19 can break the chain of infection at the mode of transmission and portal of entry by wearing the appropriate personal protective equipment. The CDC recommends the use of standard, contact, and airborne precaution with eye protection when caring for patients or persons under investigation for COVID-19. Personal protective equipment for COVID-19 includes a disposable isolation gown, N95 respirator or duckbill mask, a face shield, and gloves. The use of PPE masks is approved by CDC for COVID-19. However, the use of this mask will not be covered in this training video. Please refer to the PPE education material. Always start the donning process with hand hygiene. Apply the manufacturer recommended amount to the palm of one hand. Now we will rub hands palm to palm. Rub the right palm over the back of the left hand with fingers interlaced, and vice versa. Now we will rub both palms together with fingers interlaced. With the left thumb clasped in the right palm, rub rotationally and switch. Next, cup your hands and place the back of fingers to opposing palm and rub side to side with fingers interlocked. Rub the clasped fingers of the right hand forward and backwards in a circular pattern on the palm of the left hand and vice versa. Continue to rub both hands together until the sanitizer is dry. This process should take no less than 20 seconds to complete. Now that hand hygiene is completed, we can begin the donning process. The first item to be donned is the disposable isolation gown. When donning our isolation gown, ensure that the back is adequately covered and secured. Next, we can move on to donning our respirator. When donning our N95 or duckbill mask, use the appropriate size respirator that was determined from your annual fit test. When donned, make sure that your respirator covers the top of your nose and under your chin. Our respirator strap should not crisscross. The top strap must rest on the crown of your head, and the lower strap must rest at the nape of your neck right below your ear. Once our respirator is donned, mold the nose piece to the bridge of your nose. Do not pinch. Pinching the nose piece using one hand may result in an improper fit and less effective respirator performance. Use both hands. Start at the top of the nose clip. Mold the metal nose clip around your nose to achieve a secure seal. Once our mask is donned, we must perform a seal check. This is performed by inhaling and exhaling while using our fingers to feel for air leaks around the edge of the mask. If air is escaping around the nose, remold the nose piece and adjust your respirator. Then repeat the seal check till there's no air leaks found. Next, we must don our face shield or goggles for eye protection. When donning our face shield, place it on so the foam piece rests on the forehead. If the face shield fogs up due to breathing, it is likely that the respirator does not have a proper seal. Once you are in patient care area, adjusting the face shield and mask must be avoided. The last piece of PPE to be donned is our glove. Don gloves in the size that is comfortable and is good for patient care. Ensure no skin is exposed between the gloves and the gown cuff. Once our personal protective equipment is fully donned, this should be our final result. When it comes to doffing must be performed in a location where it's safe to do so and in a manner that reduces the potential for self-contamination from contaminated PPE. The CDC recommends that you are to be at least 6 feet away from the patient and in a way that will not contaminate yourself or your PPE. All personal protective equipment, with the exception of the respirator, are to be doffed by the door inside the patient care area. Prior to doffing, check for signs of gross contamination and remove, if possible, before continuing the doffing process. Gloves are the first to be doffed in the doffing process. We will use the glove and glove technique to remove our gloves. This is performed by pinching the glove of one hand at the wrist with your forefinger and thumb of the other hand and pulling the glove off whilst turning it inside out. Hold the removed glove in the gloved hand. Now slide the forefinger of the non-gloved hand into the wrist of the other glove and pull it off. Make sure only to touch the inside of the glove and that the glove turns inside out and envelops the other glove. After removing our gloves, the face shield is the next personal protective equipment to be removed. To remove the face shield, bend slightly forward and grasp the headband from the side or the back of the head and pull the band forward over and away from the face. Gently lower your face shield in the trash face down. When doffing our isolation gown, unfasten the gown ties. Take notice that the sleeves don't come in contact with your body when reaching for the tie. Next, we will pull the gown from the neck and shoulders away from you. Turn the gown inside out and roll into a bundle and discard in the waste container. The last item to be doffed is our respirator. Remove the respirator after leaving the patient room and closing the door. The front of the respirator is considered contaminated. Do not touch. Now grasp the bottom elastic band and pull it over your head and let it hang in front of you. Then you'll grasp the top elastic band and gently drop the mask into the waste container. Once all our personal protective equipment is doffed, we can proceed with hand hygiene. For further questions or concern, please reach out to your nurse manager or infection control. Thank you.